resident of Meeker County, and I am the rural member of the Democratic National Committee. And I was going to talk, but I know you want to hear from Collin, and we want to have a little time. So I just wanted to be happy to introduce our Congressman that you just endorsed, Collin Peterson. Thank you.
That spoke on my behalf, and thank you for endorsing my re-election one more time. This is an important election. We have the entire House and Senate up in the legislature. We've got the governor's race, and we need to be together as we go forward in this campaign. I understand that there's folks that are disappointed in some of my votes, and I get that message, and I take it to heart. And I don't have a lot of time here right now, but I just want to say that, the parts of the bill that have to do with access and coverage, that is not what I have a problem with. We need to do that. We have people that have trouble, affording insurance. We have people that can't get insurance because of pre-existing conditions. I've had a lot of those folks in my office. We need to do that part. The problem was, we also have problems on the other side of this bill that we didn't do anything about to speak of. And that is the costs, which are what's driving this problem for everybody at the base, were not addressed in this bill. And what I'm concerned about is that, without having concrete action on that end of things, that this is not going to be sustainable. So one of the things we're all going to do, all of us in the Democratic Party that didn't support this bill, we are going to work to implement it, to improve it, to continue to be a pain in the butt for the cost part of this equation, which needs to be dealt with. And, we're a pain in the butt when it comes to the deficit. But this has got to be addressed. We have Moody's rating service talking about downgrading from AAA to AA the bonds of the United States of America. I never thought in my lifetime that I was hearing of anything like that. We have people talking in the Financial Times about the United States of America becoming the next Greece. So we have got to deal with this. It's not in part, and it's part of the problem we have in healthcare. It's not just an access problem; it's a cost problem. We have let a lot of folks basically get by with murder in terms of what they're charging for healthcare. We left out the negotiation on prescription drugs, which would have saved $150 billion in this bill. It should have been there. So some of us felt like we had to be the folks that said there's a lot of good things in this bill, but there's also some things that weren't done. And we're committed over the next 4 or 5 years to make sure those things get done as we implement this bill. And I want to say this about it as well. The important part of this bill is not so much the legislation itself. It's how it's implemented. That's going to be more important than what was in the bill. Now, I'm a very good, I know very well how this works because I had a 2,500-page farm bill that we passed after 2.5 years of work. And I found out that all of the work that I put into it sometimes didn't mean a whole lot when it went to how they were implemented. So we had to spend a lot of time making sure that it got implemented right. So this election now, I think, is going to center to a large part on repealing the health care. That's going to be the mantra. That's going to be what people are out there talking about in this election. They're already starting to talk about it. I am not going to be part of it. The bill is passed. In the law, and now it's up to us to get the provisions that are in the bill implemented, and also the things that didn't get in the bill, somehow or another get them into the system over the next 4 or 5 years as well. I've got a lot of work to do on the financial regulation stuff. Marty Frank and I worked that through in the House. We got it passed in December. The Senate's now going to take it up. We're going to have a conference committee, hopefully in the next week, a month or two. We get that wrapped up. Then we're going to start hearing the farm bill. There's just lots of other stuff that I'm involved in. So again, I want to thank you for your support. I hear from the folks that didn't support me. I understand where you're coming from. I respect that, and I will do better. Hopefully in the future. One of the things that's happened since I've been chairman, for the 16 years before I became chairman, nobody came from Minnesota that I didn't meet with. Since that time, I haven't been able to meet with them because I've got too many things going on. There's just not enough hours in the day. I mean, half the people can meet with them. And so maybe I haven't been around as much as I used to, and I haven't been able to keep in touch as much as I used to. But we will do better, I will do better, and we need to be together in this election.
Yeah.
He's got some of the same ideas on the health care bill that I do. He ran 3 times, I believe, for the Senate, the House down in that area. Nancy, she's been a stalwart in the DFL, so thank them for what